Hi guys, so I just wanted to give you an update on what was first to be a tummy tuck, and then right before surgery my surgeon decided the lower body lift, as I see it is called, because he removed so much skin that and I had so much to lift from my butt. Look, you can probably even lift some more, but hopefully maybe later once I lose. So I am almost 3 weeks, not yet. But it is looking really, really good. That's where I had my tattoo. Obviously, I'm going to have to get something to cover that. I do wish it was a little lower, but I've seen some videos where it's really high, so I guess I should just be happy about that. I don't need to do, I don't know, any gauzing or anything anymore. I took out the stitches from my belly button. I went with my doctor first, and he took out one side, but it started bleeding, so he left the other ones in and told me come back in 5 days, but you know me, I don't like to drive very far, so after 4 days, I started seeing that it was really tugging and cutting into the skin, so I started taking out every other one, and it looks really pretty. I still keep a gauze in there. One thing I did notice is during coughing or laughing really hard or choking on something itchy in my throat, I ended up getting like a hard side on this side, and it goes from like here to like here, and maybe it's scar tissue, but I feel like it happened like right after I coughed really hard. You can see my gastric sleeve scar from right here, which was I think up here before. So from the upper body, I got pulled at least like an inch to an inch and a half, because there's not a lot of skin that he could pull from here. So he did his very best, but my lower body, my thighs and stuff, I have like these big huge thunder thighs that I hate. That we were supposed to do some lipo, and that didn't happen because during my lower body lift, I lost a lot of blood, and it took 6 hours from my surgery, and that was the total that they could do. So next time in, I'm going to do lipo here, fill in the little dimples on my butt. I'm hoping we're going to do lipo on these big huge thighs I have, because they're gross. I bought a second garment off an exchange because I felt like the size that I bought with the surgeon was a little bit too big after a while. So that one was an extra large, and this is a large. I went in at 143. They took off 6 pounds of skin and nastiness I had going on, and but I still haven't lost all that weight to say I got home and I lost 6 pounds. No, that didn't happen. I am pretty swollen. This is really hard down here. Up here, not so bad. You can start feeling where the swelling is, and all this is swollen. I did go to the doctor when I went and got some of those stitches out. They did put a needle in my back to see if there was any fluids, because he was like tapping it and it was like flabby. I guess he thought it was flabby enough that there might be liquids, but no, I'm just flabby back there a little bit. So that's where we're going to do the lipo. But with these undergarments, I'm pretty short. I'm 5'3", and I had to cut them because I couldn't wear anything short, so I just cut it where it started loosening up. So I just cut it, and I didn't even sew it, and it stays perfectly fine. So this is a size large that I got off the exchange. I feel like every time if it starts loosening up, I'm just going to buy a used one, because I want it to stay really tight on my stomach. But my stitches aren't that bad, I mean, my scarring isn't bad at all. I had 2 drainage tubes right here. I put Neosporin and put little gauzes on them until I didn't see anything else open. And then I had a drainage tube over here. I did the same thing with that. What hurts the most, I feel, is where the skin pulls right here. It's like, I don't even understand. Like, sometimes it hurts more than others. I feel like my butt hurts sometimes, or my thighs. I guess from pulling that up so high. But I did notice that my butt went up higher, so that's nice. I didn't think I could get a butt lift while I was at it. Wasn't really going in for that, but hey, when it was like behind my knees, that's awesome. Well, it felt like it. So once I get some of this lipoed, I'm hoping to not look as big, obviously, maybe even look a little taller, so I can maybe say I can get away with a 5'4", maybe. But other than that, everything's pretty good. I'm going to continue putting that little thing in there. I just shove it in as hard as I can. Make sure it always stays like a little hole. What else? That's it. I feel really good. I mean, it doesn't hurt. I mean, tender? Maybe. But hurting? No. I got off the Percocets probably about a week and a half. I was only taking half a pill a night because since I had the gastric sleeve, I always feel like I need to take less dosage because, I don't know, I don't want to OD or something like that. Probably not possible, but I don't know. I'm kind of freaked out about stuff like that. Taking showers, pretty easy. Back pain, a little bit. I tried to lean back on something to crack my back. Yeah, that wasn't happening. I felt like something went like stretching this out. So, other than that, everything's good. Eating, trying to drink plenty of water, but when you don't have to take pills anymore, it kind of slows it down. So I do need to drink more water. I had an allergic reaction to one of my undergarments that my husband washed with a lot of like smelly beads, and I ended up getting little water blisters that were kind of fun to pop when I was scratching them. But so we had to wash that out and get some Benadryl, and that Benadryl really helped me sleep. So if you get itchy or anything like that, I think one Benadryl would be just fine. Or if you need something to sleep, because I've been sleeping on my sides, and I noticed that the inseam on this is starting to like make it sore on my leg. So I should probably be sleeping on my back, but I'm just not a back sleeper. Other than that, I'm hoping my waistline goes in a little bit more because I feel like I'm a square. But yeah, that's it. I wanted to give a quick update. I'm trying to think of something else that I can think of. Just the coughing, I think, was the worst, or is the worst. I hold in my stomach. If I know that I'm going to be coughing or sneezing, I just hold my belly button as hard as I can, and then either try to clear my throat, and if that doesn't work, just hold it and cough or do whatever you need to do. With the Percocets, I heard that people are getting constipated. I never got constipated, so maybe because I was only taking half, but that worked for me. But other than that, this is pretty much a really good undergarment. It helps hold up the back of the skin. I felt like it helped me so that it felt like it wasn't pulling apart. Yesterday, I washed the carpets of our car. I scrubbed them, and I was out there for a while. Maybe shouldn't be doing that, but I only do what I feel like I can do. When I need a rest, I'll just make sure this is tight enough and go put my feet up, relax. I did do ice packs for at least 4 to 5 days whenever I would feel more swollen. Sometimes this feels like it's like heating up in flames those first couple days, but with the ice packs, it really made it feel a lot better. I would just sleep with them. I would wrap them up and then put them inside, so it would give me more like pressure. Even with this one, I feel like it's kind of loose too, so I might go down to a medium. But other than that, everything's really good. I'm hoping that I still have more skin where we can lower this, because when I did try on actual underwear, it was a little bit high, but I mean, if anything, I can just get a nice tattoo. Something. I just wanted something maybe in the back. I think this would be fine if I had the proper bikini or something. Maybe I'll wear one day. Other than that, everything was good. If you have any questions, just leave comments. Bye!